we can't just focus on only grandparents because they're not the entire population. They are a subset of the population that we need to consider in an aggregated population health perspective approach, meaning protecting the vulnerable if you're around them, social distance, masking, and everything like that. But since the virus is seemingly not impacting children in a very negative way, the number of deaths is essentially a rounding error. And I don't mean to minimize that to the families that have lost children to COVID-19. In statistics, individuals still suffer. But again, when we're talking about population level health, the number of children, fatalities in the overall picture of mortalities from COVID-19, it's not even a rounding error. It's like 0.001%. It's very, very, very small. Do we really need to cancel sports for all of those kids? Do we really need them to increase their screen time, socially isolate them, cause them to be on computers and screens and devices that, by the way, have their own public health issues? Those activities exacerbate being sedentary, being overweight, having metabolic issues, obesity, autoimmune, all of that, which can compromise loss of life years. And because younger people have the greatest number of potential QALYs, if we think about the pie of quality adjusted life years, elderly people, they don't have, with all due respect, don't have the biggest pie to lose. Like, the median age in the United States, I think, is 74.9 years, okay? The median age of death of the virus is like 72, right? So we're talking about, on average, losing 3 quality adjusted life years, potentially. But if you have a kid that's 7, they have, 60 plus years to lose, right? So again, I'm not minimizing grandparents. I'm not minimizing anyone over the age of 65 or over 70. But what I'm saying is we need to be able to have these more rational conversations where we're talking about, okay, are the policies that we're creating maximizing the quality adjusted life years for the entire population? In today's show, we're going to review the credibility and critically evaluate the myth, and I think it's actually really more of a lie, that's being propagated by the media and certain politicians. And that's this, that somehow public health officials and policymakers can effectively and efficiently contain the spread of a highly transmissible respiratory virus that's been seeded in pretty much every country throughout the world right now, okay? Not only has pretty much no country in the world been shown to do that, and the countries that were highlighted as paragons of public health policy and the role models that everyone should be following, and gosh, if we here in the US, if we only did what, for example, Germany did, or if we only did what Canada did, we would be just fine. But guess what? Both of these countries, as are many other countries that responded very swiftly and had a lot of transparency and listened to the experts, they're undergoing new lockdowns as of today, as of yesterday, okay? Germany's locking down again. Italy's locking down again. Remember, Italy was praised for early mandatory masking, even outdoors, okay? Even outdoors. Again, the point of this is not to criticize containment strategies. The point here is to say, okay, well, if what we did the first time didn't work, what could we do this go around when our vitamin D levels are low, when we're indoors more, when the weather's cooler, when the sun's not out, okay? Basically what I'm saying is our risk is probably higher for a more severe infection, but yet we're doing the same stuff that we did, at the middle of the winter, early spring that didn't work. Why do we think it's going to work again? So what we're going to talk about today is an aggregated public health model and review quality adjusted life years. These are terms that sound complex. They're very simple to understand. We're going to unpack that because I know that you're hanging out with friends and family, and we need to be able to efficiently convey to other people and strip away the fear and the emotion and the sensationalism and the politics and the politicalization of this virus and be able to talk in real terms, specifically looking at quality adjusted life years, because this is where the conversation gets a little interesting and it might ruffle some feathers. But again, if we're going to listen to the experts, I will share with you in the show notes expert calculations and models and things like that from scientists that have written articles in the British Medical Journal and much more, talking about exactly what we're going to speak about today. I just want to welcome you back. It's Mike Munsell here. As always, I'm appreciative of you tuning into these videos. And these shows are brought to you by our very own Myoscience Nutrition. So look, I know life is pretty uncertain right now. Maybe your sleep is being negatively affected by the change of the seasons. Days are getting darker, earlier, shorter. Maybe you're not getting as much outdoor exposure as you used to. So I highly recommend supplementing with vitamin D this time of the year, because if you live south of Atlanta, Georgia, between the months of October and March, it's speculated that you may not be getting sufficient vitamin D levels from even if you get outside. And we did a study, my mentor and I, Gerard Guillory, a medical doctor in Colorado, with a group of firemen who spent a lot of time outdoors, and even their serum vitamin D levels were low, were insufficient to offer protection for just health, but also support the health of the immune system. So I would strongly suggest supplementing with vitamin D. This is something that even Dr. Anthony Fauci, highly regarded in the field of immunology, recommends. He takes himself. And what we do over at Myoscience is pair vitamin D with a bioavailable form of vitamin K. The form of the vitamin K, it's a K2 form delivered in the MK7 form of K2. So there's a lot of different forms of vitamin K. You have K1, K2, K3, but this is vitamin K2 MK7 form. So you can use the coupon code podcast over at myoscience.com. That's Myoscience with an X, MYOXCIENCE.com. And the formula that you should check out that will be linked below is called Essential Fatty Nutrients, that has sufficient levels of both vitamin D and vitamin K in their most bioavailable forms. Okay, so let's get a little back to what we're going to talk about today and talk more about this myth that we can contain a transmissible and invisible respiratory virus by just having these hard lockdowns and these sort of, draconian measures. Okay, well, number one, if we just look domestically here in the United States, if we look at California, Florida, and compare and contrast those two, we have Disneyland is closed, Disney World is open, right? We have a closed economy in California, really strict upcoming Thanksgiving rules where you can't have Thanksgiving with more than 3 people per family or per household. I mean, it's just like California has literally almost never not really reopened. I mean, they just reopened gyms about 3 weeks ago. There's been super strict social distancing and citizen reporting of people having parties and all this sort of stuff. Mandatory masks were one of the first states in the country to mandate masks in mid-June. So there's been, if we compare the population geography, I mean, they're both fairly south, similar sun exposure, all of that. But also Florida has a much older population. But if we look here, very similar deaths, and actually California actually outnumbers the total number of cases compared to Florida. But completely different public health messages. No lockdowns, no social distancing measures, I don't know the mandatory masking in businesses in Florida, but they reopened much earlier than California did. And we have a very similar overall mortality, right? So that's kind of an interesting observation. Now, again, I'm not saying that we should all go out in closed, confined areas and never wear masks. Okay, I'm not saying that at all. We're going to get to masks in just a moment. But, what I'm saying here is the idea that a policymaker or a politician can somehow, through draconian measures and rules and mandates, influence tens of millions of people. I don't know that that's really that effective. And let's look at Germany, for example. Again, Germany has been kind of a lot of people in the media, a lot of folks in the international community, many journalists have applauded Germany for their amazing efforts and compared and contrast their strategies to the United States, saying, look, their death per capita is much lower. They acted, fast, hard, and early, all of this stuff. But guess what? It's not working for them again. Cases are up, deaths are up, and they're closing their entire economy yet again. Let's look at Canada. Very similar situation where Canada has essentially isolated itself from the entire world. They've experienced record unemployment. In the month of May, it was like 14.5% unemployment, which is a historical high compared to their previous high in the 2008 financial collapse. I think that was at 8.3% or something like that. They're still having, I believe, last time I checked, double-digit unemployment rates, at least in September. I think it was like 10.1%, and we don't have numbers yet for October. So you have, and let's pause. I know you're saying, okay, Mike, finances don't contribute to, my grandmother, not dying. What we need to understand is quality adjusted life years, okay? There is a correlation between financial hardship and a reduction in quality adjusted life years. And this is where we can start to talk about this aggregated approach, and then we'll revisit the Canadian conversation in just a moment. Okay, so let's think about, when we hear, for example, in the United States, we hear that 220,000 people died. It's because of the president, it's the administration, it's the dumb Americans, it's obesity, whatever. Let's just, first of all, unpack that, okay? Number one, every single human being that lives in Germany or Canada or the United States is going to die, okay? So what we need to actually kind of reframe the conversation to focus in on is what we're trying to do with our public health policies is maximize the health of the population and minimize the loss of life years, okay? Because we're all going to die no matter what, right? It's just when are we going to die and at what age? And if we actually look at the median age of deaths within the United States from COVID, okay, from the stats that the CDC is pumping out, 79% of the deaths occurred in individuals over the age of 65, okay? Now, that doesn't minimize that loss of life. I'm just saying a super majority of the deaths occur from individuals over the age of 65. And I think over the age of 55 is another, double digit. So we're almost 90 plus percent of the deaths are occurring in individuals 55 and above, okay? Now, that doesn't mean that their lives don't matter. Their lives were probably cut short. But this is where we need to bring in this new term that I've been kind of hinting at, quality adjusted life years, okay? So what are the QALYs lost? How much life did those people lose? Did they miss out on? Okay. Now this is important to consider because we need to consider this metric in context of all of our mitigation strategies that we're doing to everyone. Okay. When it comes to making public health policy, we're not just focusing on the people over 65 because they only represent, maybe 80 to 100 million people in the population, right? There's 100 million people under the age of 21, at least here in the United States. So we can't shorten all their life and just focus on the people that are vulnerable, right? Because if we talk about QALYs, we can reduce the quality adjusted life years in the younger people. And then that could actually cause a greater amount of total life years lost. Remember, we're all going to die. It's just when are we going to die and how painful and all that sort of stuff. So just let's table that and just consider children. What are we doing to the children? We're preventing them from socializing. They're stuck at home, okay? They're spending a lot more time on screens. We've canceled all their sports and social activities. So they're not doing any of that. Okay, they are losing quality adjusted life years. They are. I know you don't. I know you're like, well, Mike, what about my grandmother? Look, we all care about your grandmother. I care about my parents, okay? That's not what this is about. It's about looking at maximizing quality adjusted life years for the entire population, okay? So when we have these conversations, that's where we need to go. We can't just focus on only grandparents because they're not the entire population. They are a subset of the population that we need to consider in an aggregated population health perspective approach, meaning protecting the vulnerable if you're around them, social distance, masking, and everything like that. But since the virus is seemingly not impacting children in a very negative way, there's been the number of deaths is essentially a rounding error, and I don't mean to minimize that to the families that have lost children to COVID-19. In statistics, individuals still suffer. But again, when we're talking about population level health, the number of children, fatalities in the overall picture of mortalities from COVID-19, it's not even a rounding error. It's like 0.001%. It's very, very, very small. Again, not to minimize those deaths, but if children are not being negatively affected by this, and the children and their parents are not being exposed to individuals over the age of 65, do we really need to cancel sports for all of those kids? Do we really need them to increase their screen time, socially isolate them, cause them to be on computers and screens and devices that, by the way, have their own public health issues? Those activities exacerbate being sedentary, being overweight, having metabolic issues, obesity, autoimmune, all of that, which can compromise loss of life years. And because younger people have the greatest number of potential QALYs, if we think about the pie of quality adjusted life years, elderly people, they don't have, with all due respect, don't have the biggest pie to lose. Like, the median age in the United States, I think, is 74.9 years, okay? The median age of death of the virus is like 72, right? So we're talking about, on average, losing 3 quality adjusted life years, potentially. But if you have a kid that's 7, they have, 60 plus years to lose, right? So again, I'm not minimizing grandparents. I'm not minimizing anyone over the age of 65 or over 70. But what I'm saying is we need to be able to have these more rational conversations where we're talking about, okay, are the policies that we're creating maximizing the quality adjusted life years for the entire population? Now, I started that part of the conversation and I didn't completely conclude Canada. Because if we think about what is happening in Canada, they've completely isolated themselves from the rest of the world. There's historic unemployment. Businesses are closing. Okay, all of those things, my friends, those shorten and cause, it's like a withdrawal from quality adjusted life years, right? So we can't disentangle finances from health. I mean, just go up to a homeless person who's sitting there shaking a cup with poor teeth, hasn't showered for weeks, maybe hasn't had a good meal, and just think about their state of health. It's probably not that good, okay? Maybe you've experienced poverty or hardship or financial loss. That affects your mental state, that affects your sleep, that affects your stress response, that affects your relationships, that affects your ability to go on vacation, that affects a lot of things, okay? In the same way that getting sick does from a virus. So we cannot disentangle economics from health. They are interwoven. They are hard to disentangle. And if you go to parts of Mexico or Central South America that are really poor, third world countries and things like that, and look in the slums, you can see it for yourself. And again, for some reason, the media is not really doing a good job because they're politicizing the whole virus for talking points for upcoming elections and things like that. They're not sort of giving you this aggregated approach and talking about this in the quality adjusted life years and letting you know that, for example, 51% of all the money borrowed to create stimulus money is borrowed, right? We're causing inflation. We're printing money. We're selling off treasuries and things like that, bonds, and so this money is being pulled out of thin air. That's devaluing everyone's dollar. If you live in the United States and so forth, what your house is worth and cost of living and all that is going to increase. Your dollar is going to go less far due to all the stimulus that we're creating because we're closing jobs, we're canceling businesses, entire industries have been obliterated. The travel industry, the airline industry is down 80%. I mean, cruise ships, all of these things. Now, these things do harm the environment and all that. So some of you might be saying, yeah, cruise ships, like who cares if they're down? But those are people's jobs, livelihoods, weddings. That whole industry has just gotten crushed, right? Because a lot of people are wedding planners, event planners, photographers. That's a big business. My neighbor, for example, is involved in that business and he's getting hammered, right? I can see the stress building and that's affecting his quality adjusted life years. Again, so going back to this, we can't disentangle finances. When it comes to policy, and I'm not a politician, okay, but if we just think about something like a speed limit or texting and driving, isn't it crazy? There's more strict rules in the state of Tennessee, for example, for mask mandates than there are for texting and driving. To me, I think that's crazy because you're in a motor vehicle that can 30,000 plus people a year in the United States alone die from motor vehicle accidents, but we have more strict policies for individuals wearing face masks than we do texting and driving. It's insane to me. But anyway, again, I'm not undermining the health effects of the virus, but the point here is we need to have a more aggregated and personalized approach. And this is nothing new. The media focused a lot on this when it was in their political interest to talk about this. When Obama was in office, for example, it's called the PMI. The Personalized Medicine Initiative was supposed to be a big part of Obamacare. And that was this idea that, hey, we're all genetically individual. So what drug might work for you may not work for me. And so medicine has become very expensive because we're, and inefficient because we're giving everyone the same stuff. Everyone gets this test, everyone gets that same drug, same vaccine, same program. But we're all so different. Our epigenetics, our genomics, all of that, we're all biochemically individual. And so that's what this PMI initiative was about, is personalizing precision medicine, personalized and precision medicine. But what are we doing with regards to the virus? It's like a blunt instrument. We're saying, okay, everyone stay home. Everyone wear a mask. Cancel everything. Never see anyone again. For Thanksgiving, you can't do crap, okay? Sports are canceled, okay? This is a blunt instrument, and that is not in the population's best interest. That might be for exposed elderly or high-risk individuals in their best interest, but they're not the majority of the population. That doesn't mean I don't care about those people. It doesn't mean their lives don't matter. When we're making policy, it's about the maximizing the health of the population. And that's where these conversations need to go. And with that in mind, if we're talking about maximizing the health of the population, don't you think every conversation with regards to containment should also contain or consider strategies that improve health? Talking about being proactive, exercise, for example, meditation, sleep and circadian rhythm optimization, reducing inflammation, good nutrition. I mean, we could all argue over what the best diet is, but you can just say, hey, no processed food, no sugar, less than 10 grams of sugar. And so I say this with you. Hopefully you can remember some of these points, and then we can have more intelligent conversations, because the media is not being honest. They're lying to you, saying that containment is the only solution. Well, we've seen that fail now in Italy. We're seeing that fail all across Europe. We're seeing that fail in Canada. We're seeing that fail here in the U.S. I mean, look at California versus Florida, and I think that's probably one of the more comparable situations, because you have roughly similar populations. Florida has an older population, California younger, but you have completely different public health and political responses. Disneyland is closed and has been closed, and Disney World is open, right? So you have all of these comparison and contrast, very similar mortalities overall, and California actually has a lot more cases. So again, this idea that politicians can contain the spread, and that's the only thing we should be focusing on, I don't know that the evidence for that is actually still sufficient at this point in time. And part of science is the science is never settled. What we need to always be doing is asking ourselves, hey, if there's a correlation, when new data emerges, you should be testing for it and looking for different points and questioning your original hypothesis. For example, and I'm not anti-mask for everyone, but the idea that you must have a mask, like the California governor says, on the beach by yourself. I mean, can you literally say that's scientifically valid and substantiated advice? I really don't think so. But if you're in an airplane, I'm going to wear a mask. If I'm at a restaurant or a bar, I mean, to be honest with you, as much as I do like going out to a restaurant, and as a 37-year-old that's healthy, I'm not worried about getting the virus. I've had 21 clients, and I'll tell you about my latest client that got the virus very soon here. That's probably the place where you're going to get infected. And so, yeah, probably wearing a mask or at least social distancing makes a lot of sense in a restaurant and a bar type situation. So let's kind of finish off with just a little story. And this is a story about a client of mine who's been a longtime client, really nice person. I'll just say his name is Tim. His name's not Tim. So if you're watching this, Tim, you know who I'm talking about. So Tim and his wife are both clients. Tim is in his early 60s. Wife is just a little bit older than him, if I remember correctly. Tim is really engaged with his health, doing intermittent fasting, time-restricted feeding, exercise. We're working on a lot of stuff. And his wife actually needs it more than him. She has some heart issues, mild congestive heart failure, some autoimmune skin issues, digestive issues, quite a few things going on. So she actually needs to be, and her body fat percentage is much higher than his, although his is not perfect either. So they have a lot of work to do. But his wife, I'll just say her name is Sue. We've had just a few conversations, nice lady, but there still needs to be, she's not totally sold that changing her lifestyle will improve some of the ailments that she's suffering from. And that being said, so she knows that she's in the high risk category for catching the virus. She was taking all the precautions necessary, social distancing, masking, disinfecting everything. She would go to McDonald's in the drive-thru and disinfect all of her food and all this sort of stuff, and was really taking the proper steps. Both Tim and Sue work together. They live together. Obviously, they've been married for a very long time. They do everything together, in Tim's own words. Guess what? Sue got the virus. Tim didn't, okay? Now, she hasn't been hospitalized. They went to an urgent care periodically to make sure she had some oxygen when her O2 sat got down. But super high risk, moderate, heart failure, some autoimmunity and overweight, and still didn't. She's alive. She's doing okay. She's getting better. It's day 11, maybe day 12 now. She's doing better. But it goes to show you that the terrain, the host, the health, the strategies that we do that are independent of containment. Okay, so just want to finish off and say, I don't think containment is unimportant, but it ought not be the only thing that we focus on. So we also need to focus on improving health. And many studies have shown that just exercising before getting a vaccine, for example, improves vaccine effectiveness. I mean, why wouldn't we be talking about that? Why are we shutting down economies and businesses and trapping people in their homes without talking about exercise? I mean, if we're truly being authentic and science-based and evidence-based, don't you think we would kind of focus in on that? So hopefully you found this information helpful. I know when we talk about this, there's so much attachment to emotion and cognitive beliefs and biases that it becomes hard to convey these topics without triggering people. But I'm just trying to share with you a better way to communicate with people about this so that we're not having these emotionally triggered reactive conversations. So as always, friends, thanks for tuning into this episode. What I will do is put the information for the quality adjusted life years and this aggregated public health model, link it below. And I would encourage you to read these papers and these articles so that we can have better conversations with people, because again, what we're seeing in the online sphere and the Facebook and the Instagram is so much tribalism, and these reactions are really the vitriol, the hate, the assumptions that if you question the models and what's being done from a policy level, that you're unsensitive and you don't care about lives. And that's not it at all. If we actually look at the quality and consider quality adjusted life years, it doesn't support lockdowns. It does not support stay-home orders. It does not support pulling kids out of schools. A big theme of June, July, at least here in North America, specifically in the United States, has been amplifying Black voices, making the world more fair for all individuals of any background, of any equal opportunity for everyone. Well, guess who's really getting shortchanged here? It's not the wealthy white kids. They have the financial resources to send their kids to tutors and to buy computers. It's individuals that are living around the poverty line where both parents are working, or only a single parent is working and the kids are home alone. They're not getting the attention. So what we're doing is we're furthering the educational gap, which is reducing the quality adjusted life years for people of color. Okay, so I think I think it's interesting that, the people that were the strongest advocates and are the strongest advocates of social justice, of reducing the inequalities, are the same ones that are promoting lockdowns, that are advocating for stay-home orders, that are calling people grandma killers for going out to the grocery store or going to the gym. Again, you're ignoring the unintended consequences of trapping people in their homes, and particularly canceling school and sports and activities for children of families that don't have the financial resources to be able to get tutors and buy computers and do all this stuff. So we got to think about everyone. That's what this is about. This is a maximizing the health of the population. That's what this is about. So as always, friends, thanks for tuning in all the way. If you enjoyed this video, please hit that like button. Thanks for supporting our show sponsor, Myoscience. Make sure to support your body's declining vitamin D levels by going over to myoscience.com. That's MYOXCIENCE.com. Use the coupon code podcast at checkout. And as always, we'll catch you on a future video down the road. Bye now.